and I want to report back to you guys. In fact, I have so much I want to go over that it's going to take several podcasts to do it. So I think I'm going to just cover the first half day and most of the next day, and try and get some of the information out to you that I'm learning as a veterinarian, and make it so it looks, something like you guys can understand, that you can apply with your horses, or at least understand a little bit more what your vet is saying. Because our goal here at the Horse Advocate is to help you communicate a little bit better with your veterinarian and answer some of the questions that come up every day. I also want to go over something that happened, let's see, on the Facebook user group, if I can find that. And it was a question and answer that was posted in the magazine called The Horse, and I answered it. So it's going to be interesting. So let's first start with the lecture that occurred called Healing with Horsepower. The presenter was Liberty Getman. She's a veterinarian. And it was all about how to treat with regenerative medicine. And that has a lot of interest, although I think it's lagging way behind humans. But even there, it's kind of tough. So let's just get into this right away. Regenerative medicine for osteoarthritis. Osteoarthritis is something like, a bad hock, that just starts to get arthritic, a knee that's gone bad. There's a lot of evidence of arthritis in multiple joints in the horse that we want to try to take care of. And the whole goal behind it is to reduce the inflammatory proteins that are in the joint that's creating the pain. And we do that by administering things that will either calm it down or remove it. And we also want to increase the good proteins. These are proteins that are made by the body to help lubricate the joint that are not 100% and have broken down, and we want to replace those. Now, we've been using Butte for the longest period. I mean, as long as you can remember. Anti-inflammatories called non-steroidal anti-inflammatories, meaning that they're not steroids. NSAIDs, they're sometimes called NAISDS, non-steroidal anti-inflammatories like Butte, Banamine, Equiox, Previcox, and others. They all, it's like you and me taking a Tylenol, like Cedrin, or whatever your favorite anti-inflammatory is. It goes in there and it shuts down the inflammatory pathway, and it makes the pain go away. So it's blocking the signal. So that's good in that we can now sleep, or the horse can move around. It's bad because oftentimes this leads to more damage within the joint. And of course, that can lead to other problems down the line. But you already have a problem if you have osteoarthritis. Many of you who are older have gone to the surgeon and said, just take the joint out, give me an artificial joint, whether it's a knee, a hip, an elbow, whatever. And these surgeries are miracles in humans, but they are not happening in horses, mainly because the materials used for these joint replacements cannot hold up to the weight of a horse. So you're seeing it in dogs, other small animals, but you're never going to see a knee replaced in a horse because it would break as soon as the horse got up from anesthesia. So let's just go to what she had to say on this subject. And she used the terms good proteins and bad proteins, which I thought was a really interesting thing because, you know me, I'm big in proteins. And I tell you that there's between 1 and 3 billion proteins per cell of your body. And a lot of you guys think protein is just your muscles, or maybe the connective tissue, or maybe you say the hooves and the hair, which is great. They are. Maybe you'll say neurotransmitters, enzymes, etc. But there are a lot of tissue factors that are proteins that make things happen. For instance, interleukin-1, a highly inflammatory protein, is necessary, but in excess is not. Another one is called tissue necrosis factor, or TNF-alpha. And these are basically cytokines. These are substances, molecules that create inflammation, and from that you create pain. And if you give steroids or non-steroidal anti-inflammatory, or even hyaluronic acid, you're basically calming that down. The hyaluronic acid calms the synovial membranes down so they can start to produce new synovial fluid, and that is replacing the old synovial fluid. And again, it's calming inflammation. It's not taking care of anything. It's not healing anything. It's just quieting the storm. And unfortunately, the storm comes back. As we all know, with osteoarthritis, if your horse has a bad hock or navicular, which can be arthritis, can be some other things in there, caudal heel pain, a bad fetlock, an injury in the back, any place where there's a joint, there can be osteoarthritis. And these non-steroidal anti-inflammatory steroids and hyaluronic acid, whether it's given IV or in the joint itself, are going to calm things down, calm the inflammation down, and make the horse feel better. There's also other drugs such as Tildren, Osphos, even Shockwave can come in there and try to just numb the joint, and that's all it's doing. So it's going to decrease the bad proteins by binding to them, and it's going to increase the good proteins, and that's great, but it just doesn't do it that well. So there are some other products out there that you might have heard of. Some people have talked about plasma, and the plasma is plasma-rich. Plasma, there's IRAP, which stands for something that I used to know. And I just don't have it right now. But that's plasma, and it's anti-inflammatory. The problem with IRAP, even though it was good when it first came out, is that's an anti-interleukin-1 product, basically. It binds interleukin-1 and creates an anti-inflammatory effect. The problem is you have to harvest the plasma and let it incubate. And that actually creates this anti-interleukin-1. And then you have to get 3 injections, and it's good anti-inflammatory, but it's not anything. It doesn't help with healing. So you have plasma-rich, protein-rich plasma. So this is going to be a little bit different because platelet-rich plasma, sorry, I got it wrong. PRP is platelet-rich plasma, which is plasma with the platelets in it. So that's adding another factor. The platelets, they have growth factors, and growth factors allow for tissue healing. So PRP is better than IRAP for that reason. PRP is good for soft tissues. It's not great for osteoarthritis. It'll help when soft tissues are involved around the joint, but it's got some drawbacks, and it's, again, not for osteoarthritis. So to make it, there's different devices, and I'm not going to get into it, but basically, they say to use it early in the disease and use it in place of steroids, and the effects can last up to a year. But the problem is it's a very slow onset. So it takes about 3 weeks to get in there. In the making a plasma-rich, platelet-rich plasma, you get a fraction called platelet-poor plasma, which nobody's ever talked about, the PPP, and it's normally just thrown out. But they're suggesting that you can freeze it and use it on wounds, corneal ulcers, and even in the uterus to help with some inflammation in there. So I thought that was really good. Now, they also talked about using platelet-rich plasma. They actually use Restigen, and they talked about Prostride, which are 2 different devices to make that. And a lot of people are doing that now right there on your farm, which is kind of cool. They said that you can do this as yearly maintenance. You can also do it as post-op. They also said to use in grade 2 or less for best results. So grade 2 lameness, grade 3 is pretty bad, but grade 2 isn't so bad. It's very subtle, and it'll last 8 to 9 months. And you should use things like chiropractic acupuncture, change the workload, medications as necessary to decrease the pain. So it's okay, but it's not perfect on its own. So you got to help it along. And then, of course, grade 3 is severe osteoarthritis. And they recommend rotating therapies between the Prostride, which is the platelet-rich plasma, hyaluronic acid / steroids, and the polyacrylamide, which are these injections that are going in the joint and act as a cushion, which I'm going to get briefed on tomorrow at tomorrow's lecture. So I don't have much on that. They did say avoid using 3 or more times. Her bottom line, I love writing these things down. Nothing really works. And I'm sorry I'm laughing because I know many of you have horses that do have osteoarthritis. You might even have osteoarthritis. And of course, laughing about it doesn't help anybody. But the truth is, prevention is the best thing. And I'm going to go into it. You know me. I'm just going to talk about prevention. Stop feeding inflammatory ingredients. Lighten the load of your horse. Stop feeding sugar, and add some high quality protein so the cartilage can be built. The muscles and tendons and ligaments and other support tissues can be there to support the load of the work that you're putting on your horse. Remember, if you get an underpowered pickup truck to pull your big horse trailer, your pickup truck's going to die. So you have to build it up with good springs and brakes and engine and everything you need to haul the load that you've got behind you. And if you're asking your horse to do something that's a little bit too much for their body, they will break down. And if you're not feeding the materials they need to stay strong, then it's just going to fall apart. And you're going to hear me say this throughout the whole podcast and all my analysis or synopsises of these programs, because it's frustrating because nobody talks about nutrition at all so far in 3 days of this. Anyway, the next 3 lectures were required for all veterinarians in Florida to talk about the Florida law and rules and dispensing legend drugs. And I'm not going to bore you about that, but every vet in the state of Florida has to do that. I don't see that happening in any other state, but Florida's always had this, and it forces us to go to these continuing education things, but that's fine. And then at the very end, around 5 p.m., Amy Grice, a veterinarian who's also an MBA, talked about emergency service and thinking outside the box, which is interesting because there's a theme that we've been talking about here at the Horses Advocate, and that American Association of Equine Practitioners has been talking about. And Amy Grice spent 3 more lectures the next day talking about how to create a healthy practice. And I know it's important. I know it's a crisis, as I've talked about in the past. And just today, I spent some time talking with a fellow veterinarian, Anne, who is past president of the FAEP. And we were just talking about stuff, and we got on this crisis that is occurring. Horse owners can't get good horse vets in their area, or can't get any vet, I should say, in their areas. And she shocked me because she says she personally knows 5, or was it 6 veterinarians she personally knows who have taken their lives, committed suicide, no longer on this planet, because they have been bullied and bullied by clients, people like you listening. They talk to their veterinarian and they say, you're charging too much. You don't know what you're doing. What happened to good old doc so-and-so? They used to do it better. They used to do it best. Why can't you come out and help me? And on and on and on. And she even said to me, and she's my age, she says, I just got bullied by a client who basically said, no, she didn't want to pay that much money for the price that that Anne had charged. And she says, bullying is, we're tough. We've been through it all. We know what it costs to operate to get us there. And this is what we have to charge. And yet people are there. They don't have the money now. It's getting tighter and tighter. And so now they don't have veterinarians. They don't have money. And they're going to be giving up on horses pretty quickly. And so again, it's a crisis going on, and we're in that state of flux that the veterinary profession is trying to do something about. And one of the biggest reasons, I think number 2 on the list of why veterinarians quit the equine practice and go to small animal, is that the emergency service is just too much for them. The first is they don't get paid enough. The small animal brethren get paid way more, not double, but gosh, 80% more. And, you know, if you're given a choice between, let's say 60,000 and 100,000 to do a job, where at the 60,000, you had to be on call all the time, go out on weekends, nights, drive through traffic in all kinds of heat and cold and bugs and ice and whatever, versus 100 grand sitting in a nice environmentally controlled room where the client brings their animal to you, what would you do? And it really boils down to that. So Amy Grice came and talked about emergency vet care. And the number one reason, according to the a survey done of horse owners, the number one reason they select a certain vet is that vet offers 24/7 care, which is a problem. I heard everybody talk about, yeah, I've driven an hour and a half to get somebody, and I'm almost there. And they called and said, no, we fixed it. The mare delivered. Everything's fine. You can go home now. They don't even offer to pay for the vet driving 3 hours from their house and back. They don't do that. It's just, you guys listening to this, if you're a horse owner, you got to put yourselves in the shoes of the veterinarian. And I know that there's some veterinarians out there that you don't want to get in their shoes. I get it. But most of them are just people, and they're all working hard. They've committed to doing this, to caring for your horse. And yet one of the biggest reasons they leave, next to not having enough money, is that they have to work 24/7, have no time off for their family. They don't have that space that everybody needs to just take a deep breath. And they put the weight of your problems on their shoulders. Now, you can come back and say, well, it's been, 5,000 years since you had a day off, that you've gone out to the barn every day. And that is a choice in owning a horse. And it's something you have to do. I don't care if you have fish in a tank. You still have to take care of the tank and feed it. When we bring in pets or any animal into our lives, or children into our lives, it's a responsibility that we take care of, and it's your choice. And these veterinarians, they're making a choice of serving this group of people 24/7 to help. And veterinarians, I guess it's the generation, they seem to be getting burned out quickly. They can't handle the load. A lot of you are saying, oh, you're a bunch of snowflakes, the wind's blowing the wrong way, and you run with your tail between your legs, and you quit, and you run off and become a small animal vet. And yeah, I can understand that you're angry. You're angry at the young kids coming out. But generations change. I know when I was a kid, I couldn't stand, my parents or grandparents. I respected them, but I couldn't stand what they stood for. We all do this, and the generation's doing the same thing. It's happening in our country. It's happening on the roads out there, and we have to deal with it. And it's affecting the care of our horses. So I'm grateful for people like Amy Grice and the others who are trying to come up with solutions that will at least meet us halfway. So I want to tell you about the, 6 or 7 things that they talked about as alternatives. The number one was telemedicine. The problem with telemedicine is simple. The horse owner calls a vet, says, I need some help. There's something going on with the horse. I don't want you to come out. Please tell me what to do. And the vet will say, well, what's the pulse and respiration? What's the horse doing? Yes, it does sound like colic. Did you hear any gurgling sounds? So go ahead and give some, anti-inflammatories, 10 cc's of Banamine, a little bit of Rompin, whatever. I mean, you've set this up, you know what's going to happen. And then you hang up the phone and said, thanks, I'll call you if I need you. The problem is, according to statistics, I can't say it, 75% of the veterinarians who do this don't send you a bill. And she says, that's crazy, because you just asked the veterinarian for professional advice. There's a client-patient relationship set up because you're calling your veterinarian who knows your horses, and you've asked for some professional advice. And I know if I ask this of my accountant or my attorney, there's a bill. It comes, and I have to pay it. But veterinarians don't do it because they're afraid that you're going to make a stink. But how about this? Doc, I appreciate it. How much do I owe you? That's all. So that was the first thing, telemedicine, that obviously pick up the phone, just get some support, just make sure that you're on the right track. I get a ton of photographs. Here's a photograph of a tooth that I found, or this is the front teeth of the horse. Or I even get people asking me about colic and wounds and things, and I get images all the time. And very few people say, thanks for your time, Doc. I appreciate your professional advice. Send me the bill. And nowadays, you just send a bill and you click it and you pay with a credit card. It's done in minutes. The second thing that veterinarians are doing is they're starting these emergency co-ops. So the idea is that there's several small practices in an area, and you've elected to use Dr. A, but there's Dr. B and C as other choices. And you've chosen Dr. A because you don't like Dr. B and you don't know anything about Dr. C. So you call Dr. A, and Dr. A is out fishing someplace, and he's got Dr. B or Dr. C covering. Now what do you do? So the emergency cooperatives are great on the veterinarian's end, because now they can go out fishing or spend time with their family or do something to do R&R. But maybe you don't like it. So now what do you do? Well, you're going to have to do something, because your horse needs veterinary care on an emergency basis. He's got a torn eyelid, a cut fetlock, broken bone, God forbid, whatever. And that's tough. The only options that they have for that is that the veterinarian can hire a relief vet, and you can send out a notice to everybody and say, okay, I'm gone the month of November, let's just say, and I'm hiring Dr. So-and-so. And that vet is going to be doing all my emergency calls and anything else you need them for the month of November. You're actually still paying your check to me. I'm paying them as a relief vet, and I just need the time off. I've got a wedding. I've got a sick family. I've got whatever reason I've got to leave. Here's your relief vet. Trust me. And, that goes pretty well, usually. Or you got an emergency, go over to the hospital an hour and a half away. Go over to, the university, wherever. But veterinarians need to get away, and they decided that they make emergency co-ops with other vets in the area. And if that's what your vet is going to do in your area, that is an option. The referral hospitals, I used to send all my emergencies. I mean, I would see the emergency, but if it needed to be escalated off, it would go to Cornell. But I never went away and said on my voice, well, if you got an emergency, go call Cornell. I never did that. But a lot of people are starting to do that. And these referral hospitals are starting to say, wait a minute, we don't have the staffing for this. Our staff leaves at 5 p.m, and your emergencies are coming in at midnight, and we don't have the vets on call enough to handle this. So they are now starting to set up a subscription, which I thought was kind of interesting. So either the referring vet basically buys a set amount of time for this hospital to cover the referrals. So down here, it would be one of the hospitals down in Wellington. I doubt if I'd send anybody to Gainesville, but certainly Ocala, that's 2 hours away. And that's an option. But you better have a trailer, and your horse better be able to get in the trailer, because that's how it happens. You have to take the horse to that hospital. So there's a downside to that as well. A lot of veterinary services are now just saying, look, we're only doing it for clients only. If you're not a client, either we're not going to see you, or we're going to charge you, according to this, 66% more. So instead of $100 to come, we're going to charge you $166 just to come. And that's okay, because they can have a wellness program where the veterinarian comes out once a year to check every horse and charges you a flat fee to do the testing, the vaccinations, the dental exam, the overall health, general condition of the horse, and anything else you want to ask them as a flat fee. And for that, you're buying into this service. So if you never have an emergency, the vet makes out. If you have 100 emergencies, the vet still makes out, but just not as much. There's another one. They have haul-in centers. So again, that's kind of rare. That's like a referral hospital, except you're not going through a veterinarian. You just throw the horse on and you take it to this hospital and say, here I am. And again, it's going to be hard to find people at 2 a.m. when your horse is trying to deliver a foal and get your horse with a baby trying to come out into a horse trailer. Then there's emergency only practices. And there's one right here in Palm City. Big shout out to Carrie. She will take your call. People know that they can call her directly. She'll also have subscriptions with practices in the areas saying, you can clock out at 8 p.m. and I'll cover your practice from 8 p.m. to 8 a.m. Whatever comes in, I'm doing that for you and for 3 other practices, and she'll cover it all. And that's what emergency vets do. What I like about that is emergencies always have a spin. It's not a routine thing. It's like my horse has slipped and fallen into, believe it or not, these two have actually happened. One was into a cow manure slurry pit. She had broken a leg, and that horse had actually slid down into the veal calf slurry pit. It was the most god-awful smell. And they called me and I said, look, I'll come out. I mean, you need me. But is there any way you can like hose her off before I get there? And they had to go down into the slurry pit and get this horse out of there with a broken leg. And they cleaned her up and brought her, as far as they could. And that was a sad case because it was a horrible fracture through the skin and horribly contaminated. So prognosis was awful. So I was just there to euthanize. I know another veterinarian who said there were garages where car repairs were made, where your car would just drive in and there's a mechanic's pit. I believe they're illegal in every state now. You just won't find them. All cars drive up and are lifted up in the air, and the guy works underneath it because people would fall down into these pits and break their neck. So it's a safety thing. So they got rid of them. But there were two things. One, a horse that fell into one of these garage pits, and the vet had to get him out. And the other was one that fell into an empty pool. And, these things happen. So if you don't like emergency work and you're not creative, then maybe you don't want to be an emergency vet. You'd be better off hiring an emergency vet. So that's a plus. The seventh was relief veterinarians. They're becoming popular. I think I told you about that. And then the subscription model, clients using traveling vet specialists, then subscribe to local vet for emergencies. So if your veterinarian spends the winters down here in Florida and the summers up in another state up north, but you stay in the area and you don't travel where the veterinarian goes, you can hire on another practice and say, I want to use your services for 6 months and work out a deal with them. So when Dr. So-and-so is gone, there's another doctor there to help you out. So that was a pretty interesting one. It did bring a tear to my eyes, just a little personal note, because one of the things that veterinarians are concerned about in sharing the workload with other practitioners is the fear of losing their client. So your veterinarian goes away and you hire another veterinarian to come in to fix your horse, and then you stick with that other veterinarian, and your first primary veterinarian is given the boot. And I've always said this, if that happens, it's because I wasn't doing my job. I wasn't doing it well enough that I could hold somebody to staying with my practice, and I deserve the loss. That's the way I've always thought, but that's just not the way a lot of vets think. A lot of vets are scarcity conscious. They think that if somebody comes in, they're going to steal that client and they're going to be out future income. And it's really common. It's almost like laughable. I think it's one of these human traits that people have, fear of losing. So Dr. Grice said, well, there's this veterinarian who basically died and accidentally, and he was my original mentor. He was Dr. Steiner originally took me out when I was just a stall mucker and showed me all sorts of things about how to become a veterinarian. And he encouraged me to go to Cornell. I give him all the credit for really getting me going. And he retired. He's world famous repro vet out of Kentucky. He came back to New York, and he was just helping out some guys in the breeding shed near on Memorial Day. And I got the full story. The stallion was acting up. The helper wasn't very good. So Dr. Steiner said, hey, you take the AV and clean it up and get it prepared. I'll take care of the stallion. And the stallion dipped and threw his shoulder into Dr. Steiner, who fell down, smacked his head, and started bleeding out of his ears. And that was it. He never woke up. And it can happen to any of us at any time. But the point she's trying to make was the practice received call after call after call saying, but Dr. Steiner was supposed to come out and palpate my mare. What are we going to do now? Who are you going to send? So in other words, all of us are going to die. The problems that we have are still going to be there. The appointments that we set up are still going to be there. And the world keeps turning. So if you don't take care of yourself now and take the time off and regenerate, rejuvenate, whatever it is, reconnect, you're going to burn yourself out, and these vets are going to be gone anyway or commit suicide. So she said it was really important to understand that we all need to walk away every once in a while, take deep breaths. It's something I've learned, I've tried to do every day now, to just appreciate life. And that way, when I'm with you at your farm, I give you 100%. It's not a partial, it's absolutely 100%. All right, so let's see, 35 minutes in here. So let's look at the next one. This was Dr. Chris Elliott, who talked about the science of joint supplements. What does the evidence say? And you know me about evidence. The question he's trying to ask is, what can we use that's effective against osteoarthritis, or what everybody just calls arthritis? And it's all about relieving pain. So he basically said, well, what's the evidence that's out there? Well, he also talked about evaluating evidence. And that is just plain to my heart. You've heard me on this podcast talk about evidence, how poor studies are. There's not enough power. There's not enough people, horses in the study to make it valid. There's too much bias going on. Horses are used for multiple trials because nobody has the money to just use these horses on that trial and those horses over there for that trial. And science, evidence-based science in the equine industry is sorely lacking and not done well. And I've said this a million times, and I'll say it again, but it made my heart sing that he stood up in front of the audience and said, most evidence in this field is poor. He said the human literature is better, but it's still not strong. And in humans, you can test anti-inflammatories on tens of thousands of people. In horses, you'll be lucky to get 100. So the overall theme that he's saying is that we're moving away from supplements with medications and we're moving toward antioxidants. Now, hold on, if you don't know what that means. A medication such as butazolidine, whatever, Previcox, Equiox, is a medication you're supplementing with to fix the problem. And there are other things out there that can help absorb the inflammatory ingredients. And those inflammatory ingredients are basically free radicals. I don't know if you guys remember, but I told you that humans who eat seed oils are all the oils you eat with the exception of the fruit oils, olive, avocado, coconut. So if you're eating seed oils, corn oil, vegetable oil, safflower, sunflower, canola, soybean, and any other oils that are out there, when you eat those oils, they can actually bind to the breakdown products of gut bacteria in your gut. They're called lipopolysaccharides. And that combination can leak through the gut, and they've found them in human joints, and that causes inflammation. Interestingly, I asked Dr. Chris Kawczak, K-A-W-C-A-K. I'll talk about his talks a little bit later, but I asked him if he'd ever heard of that. He says, oh, yes, there's no doubt. So he confirmed what I said. Anyway, that's basically a free radical, and we're now starting to feed things that can go against those free radicals, and that's going to also relieve pain. So that's kind of good. So the first one up on his list was glucosamine. And glucosamine oral supplementation, I've seen so many people buy it, and they say, what do you think of this, doc? And I say, I think it's garbage. Well, it turns out that the studies, the evidence is now showing that horses, when given glucosamine oral supplementation for 3 months, had absolutely no effect on the osteoarthritis. And in human studies where they gave oral glucosamine, they found that there was absolutely no difference between giving glucosamine and the placebo that was given at the same time to the matching group. So glucosamine oral supplements, don't waste your money. That's what he says, and I couldn't agree more. Then I picked on Cosequin ASU, and I forgot what ASU stands for, but it has glucosamine in it. But it also has additional ingredients that he thinks might work, which includes boswellia, and then there's some other ingredient I could look up, but that's where the ASU comes from. And it could be that those things are what's having an effect because they're antioxidants. Then he went on to rose hips, and he says there's no evidence that it works, but it works well. So in humans, it alleviates symptoms of osteoarthritis, and reduces the necessity of taking anti-inflammatories like aspirin, Tylenol, etc. So he says rose hips work pretty well on horses. I thought that was kind of interesting. Then he said green lip muscle extract. Now, I have a client who absolutely believes in green lip muscle extract, so much so that she convinced my wife to get it for her knee. It didn't work on my wife because it's not her knee. It's outside the knee. It's a collateral ligament. And that's what's painful. So it didn't work on her. But this other woman said she became pain-free taking green lip muscle extract. It's from a specific muscle, the kind that lives in the ocean, like a clam, from New Zealand. Anyway, in horses, they were able to decrease the lameness score by 1 grade in osteoarthritis in a fetlock. So that's kind of cool. And then he talked about something called foresight, the number 4-CYTE, which is green lip muscle, abalone, marine cartilage, and then this conifer extract called Biota orientalis. And that helps decrease interleukin-1. Again, interleukin-1 is one of the inflammatory products. And the evidence said it's best and it's high quality and it's affordable. That's what this guy says. So those are things that you can think about giving orally to help your horse with pain. Then he went on to pentosan polysulfate, which he happens to really like, and it decreases cartilage fibrillation and works on subchondral bone, and 58% improved 1 grade lameness. And you do it once a week for 4 doses. He says basically it's old school, works well, but it's now falling out of favor for an unknown reason. And then he went on to polyglycan, which he says you can give IV or IA and get good results intra-articularly. So these are products that are made specifically to help heal the osteoarthritis, help heal the cartilage, the subchondral bone, and improve by decreasing the bad proteins. I talked to another veterinarian who's been around a long time. She says, oh my gosh, stay away from those 2 drugs. She says there's a lot of horses that are not doing well when you're given that multiple times. If I recall, in the first lecture, that veterinarian said don't use it more than 3 times. So you can take that one with a grain of salt, but I'm just telling you what's going on. Then it comes to my favorite, which is Adequan. It's been around forever. It's #1 in the USA. But what's interesting is, and I didn't know this, Adequan is bovine lungs and trachea extract. And I'm like, wait a minute, what? And it's better interarticular, but it can be just as good intermuscularly. And don't hesitate to give more if your horse is large. So Adequan, I tell everyone, don't even hesitate. Use Adequan. It works out all the time. But if you don't want to give animal products and you want to stick with something that is plant-based, go to rose hips, I guess. I don't know what else to tell you. His final was hyaluronic acid, which has been around forever. He still doesn't know what molecular weight you should use. They've been arguing whether you should use higher or lower molecular weight since the 1980s. So, and they still haven't solved it. But you can give hyaluronic acid and triamcinolone. But it turns out that if you give hyaluronic acid and triamcinolone, there's no difference as steroid alone, and the steroid alone is cheaper. So the hyaluronic acid is short-term anti-inflammatory, and it doesn't cause damage, but you're going to get a better effect just giving a steroid. But if you give it 2 or 3 times, you're basically breaking down that joint, and your horse is going to be put out to pasture. So there's downsides to that. But hyaluronic acid is around for a long time. So Adequan seems to be the best. So then he gives the summary, and this is really interesting. you want to prolong athletic careers and delay the onset of osteoarthritis, and you need to do a cost-benefit analysis. And he said in America, they prefer injections. In Australia and the United Kingdom, they prefer oral supplements. So let's just talk about this for a second. Let's talk about prolonging athletic careers and delaying the onset of osteoarthritis. Well, you know what I'm about to say, right? Because you've been with me a long time. You know my feelings on this. If you stop feeding inflammatory ingredients, which include the seed oils, the byproducts, the synthetic vitamins and minerals, you're going to improve osteoarthritis, or you're going to reduce it. Yes, there's repetitive motion, there's trauma, I get it. But again, the whole skeletal muscle system is protein. And if you're not feeding high quality protein with all the amino acids you need to build to resist all the pressure you're putting on your horse, whether it's turning tight turns in a barrel race, or stopping quickly in a cutting horse, or jumping a high fence, or running as fast as you can around in a circle with or without pulling a cart, or anything else you do with horses out there. Even pleasure riding, because maybe you're a little overweight and you're putting all that weight on the horse and you're asking that horse to ride for 2 or 3 hours through the woods, going up hills. Certainly endurance riders, competitive trail riders, they're pushing their horses hard against uneven terrain, asking so much of your horse's musculoskeletal system. And if you're not removing all inflammatory ingredients and adding enough high-quality protein so they can build as you train them to prevent this, you're just going to have it. It's just going to occur. Can't say it enough. I'll say it again. I'll keep saying it till I'm blue in the face. But literally, start changing the way you feed your horse, because you are what you eat. All right, so that takes me up through Friday morning, and then I've got the next section, which I'll do another podcast on, which is a lot about lameness in horses, followed by bacteria or viral infections in horses, including coronavirus, and more on lameness, just axial, just meaning the neck, the body, along the backbone, and where the backbone and the hind legs meet. 3 separate lectures, one on each part of the horse, by world-renowned veterinarian out of France who had such a thick accent he's hard to understand. And then tomorrow I'm going to be listening to metabolic syndrome and vitamin E. So that's all I want to tell you about that, basically. Let's go over to an article. I'm just going to punch a couple of buttons here to get there. That was found in the horse. And it was titled Soybean Meal for Horses. Is posted June 12th, 2023 by Kelly Vineyard, Vineyard, who has a master's of science and a PhD, a senior nutritionist in equine technical solutions with Purina Animal Nutrition. And this is a Q&A. And I can't wait to read you the Q. The question is, a new vet came to our barn recently to check our horse's teeth and recommended a soy meal diet instead of grain. What is your input on soy meal as a staple for horses? Gosh, I wonder who that could be. I mean, it could be some other vet. It could be anybody, but I certainly fit that profile. So she spends a lot of time saying basically that soybean meal is an excellent source of protein for horses due to its high quality amino acid profile. Couldn't have said it better. Specifically, it is rich in the essential and first limiting amino acid lysine and other essential amino acids methionine and threonine. For this reason, many premium commercial horse feed formulas include it as an ingredient. And I love that. I mean, bingo. Not only she said it's really good, but everybody uses it because it's really good. But then the rest of it goes on to say, if you feed it and only that, then you could be creating a nutrient deficiency, weight loss, or both. And I you know what I had to say. Yes, your horse is going to lose weight because you're going to remove all the grain, which has the inflammatory ingredients and the excess calories they don't need. And so your horse is going to switch over to using body fat, and he's going to decrease the body inflammation. He's going to feel happier, and his behavior is going to improve. And your horse is going to get the amino acids in the amount they need to build the muscle, the enzymes, the neurotransmitters, everything else that's been lacking over a chronic loss of protein due to feeding all the grains that they say. Now, of course, because she works her Purina, she believes that your horse needs a balancer. And I thought that was kind of interesting because, you know, my thoughts on balancers, they're filled with inflammatory ingredients. So she says a better strategy might be to feed a ration balancer or a feed product with a low feeding rate, typically 1 to 2 pounds per day per 1,000-pound horse, specifically designed to fill in the nutritional gaps of a forage-only diet. So what she's doing, she's playing on your fear that you don't know what you're doing. And because of that, and your desire to do the best for your horse, you're going to go to a manufacturer whose job it is to sell you stuff. And you're going to throw in a ration balancer that has synthetic vitamins made in China, by the way, almost all of them. Synthetic minerals, again, made in China. Synthetic amino acids, where lysine, threonine, and methionine are also added in addition to the soybean meal. And again, they do that by genetically modifying bacteria so they produce these amino acids. And there's no guarantee that what's on the label is in their package. They're relying on the fact that their name on their brand is going to be good enough and you're going to trust them. But who made it? How long ago did they make it? Has it been sitting in a shipping container for years? How fresh is it? Whereas soybean meal is made once a year. It's an annual crop. It's fresh. It has all the amino acids in there because that's just the way it is. So that's what they want you to feed. And it's filled with wheat middlings, inflammatory waste product, rice hulls, waste product, sugar beet pulp, waste product. And then they add lignin sulfonate. And lignin sulfonate, of course, is there to create a liquid slurry for well drilling, for concrete and sheetrock production, and to control dust on dirt roads. Oh, by the way, it's an antioxidant for animal feeds. So they're putting all this stuff in, saying that that's better for your horse than just feeding soybean meal in an amount that gives your horse all the essential amino acids that brings it up to a minimum of 1/2 gram per pound of body weight, which is exactly where you want to be. And all the vitamins are going to be made by the horse or in the hay or in the pasture. And we really don't know much about vitamins in horses, as you heard in that podcast I did. There's just not enough good information about it. I'll be listening to my tomorrow to the presentation on vitamin E. I can't wait because I think we're going to find out that they still don't know what's going on. And the minerals are coming out of your water if you're pumping it out of the ground and from the forage and the hay. And they'll tell you, well, we don't know that it's been overgrazed or over farmed and, you know, et cetera. So it probably doesn't have all the minerals that it's supposed to have. So I just ask, to tell me, just broad terms, how many horses have you seen with vitamin deficiencies or mineral deficiencies? And I doubt if you can find even one. But then I can tell you over and over and over again how many horses are definitely protein deficient. You looked at their hooves, the crushed tubules in the heels, the crushed heels, the walls that are splaying out or splitting, the soles that are thin. Or you look at the suspensories that are no longer working and the horse is laid up for 6 months or more. Or the top line whose condition is gone, and so it can't support the axial muscles. So you're starting to get these lesions in the spinous processes. So it's just, and of course, neurotransmitters and PPID, which they're going to talk about tomorrow. PPID, pituitary pars intermedia dysfunction. Anyway, and then they go on, they talk about a body condition score, and they said about losing weight. And what they just don't understand is I can I can have you lose 10 to 20 pounds, depending on your size, by just coming over and cutting your arm off. Because when you talk about weight, what exactly are you talking about? Yes, they're going to lose body fat, but they're also going to gain muscle by eating all the protein. And they're going to get healthier skin, and they're going to get a healthier immune system and neurotransmitters that work. They're going to get all these things by eating a high quality protein that is just not available in horses kept behind a fence and not migrating. And I'm telling you that there's a better way to handle the essential nutrients that your horse needs. You can get all the fat and all the sugar out of hay and pasture. You can get the minerals out of the water pump from the ground. And if for some reason you're using city water, I get it. But you're all putting up a salt lick. If it's mined from the earth, like a Himalayan or Redmond rock, it's going to have all the minerals you need. And almost all the vitamins are made somehow by the horse's gut. Certainly vitamin K, all the B vitamins. We know horses don't need to eat vitamin C. They can make it. So that, again, is your gut bacteria. So that leaves A, D, and K. And nobody knows where vitamin D comes from. They think it's from pasture, but we don't know. Humans, we're told to, sunbathe, naked, get as much sun as we can to get our vitamin D. But then again, horses are covered in a hair coat, and marine mammals are covered in water. So where are they getting their vitamin D? And vitamin A, I don't see a problem. They talk about night blindness, but that's pretty rare. So, if you have to, if you really, really feel like you've got to feed vitamins and minerals, get the best you can. Don't skimp. Find the ones that have a guaranteed analysis. Put your money in there. Don't just say, well, I'm going to get this balancer because it has so many inflammatory ingredients and unknown sources. So, gosh, if you really want to do the best for your horse, then do the best for your horse. Anyway, so I just want to go over that and let you know what has gone through my mind. I've got probably 3 or 4 or 5 more podcasts in my mind already based on this meeting with my colleagues, trying to figure out what horse owners want and trying to make this a better world where your horses can thrive. And that's what our goal is all about. So I'm just going to end this one. Thank you for stopping by. I've got to be an hour south of here by 7 a.m. tomorrow morning to get some more information. And I'm probably going to do 1 or 2 more of these before, so I have them all set up and ready to go because I have a long trip. I've got a lot of horses to float coming up. All right. Thank you so much for joining me. I appreciate it. I try to make these enjoyable. Sometimes they're eclectic, meaning that they cover multiple topics, not just one. But this is what all your veterinarians are doing. They're all going to these conferences, and we get bombarded with all this information. And I see so many vets sitting there. They're falling asleep. They're like, they can't wait to get out. They start talking in the halls, and nobody's saying, that guy didn't sound right. There's something wrong there. No, I don't know what vets are doing, but we all got to start to get our thinking caps on and start asking our questions. What's really, really good for our horses? Anyway, thanks for joining me. Doc T out. See you next week.
Hey everyone, Doc T here. Thank you for listening to my content. Would you do me a huge favor? Would you please subscribe, comment, like, thumbs up, and give a star review? However it's presented to you, I want you to do that. There's two reasons. The first, of course, is to improve this product. This way I know what you like, what you don't like, what I can improve upon, what topics you want me to cover. But more importantly, it's also going to help others find me. And by doing that, you are now engaged in this mission of helping horses thrive in a human world. By you helping, we can reach others. And that I would be so grateful for. And remember, go to thehorsesadvocate.com for updates on this information. Thehorsesadvocate.com. And again, thank you so much for being here. Doc T out.